Hello everybody, myself Dr. Shogata Madhu, pediatric gastroenterologist and hepatologist. On the occasion of World Hepatitis Day, today I will discuss hepatitis E infection. It is a common waterborne viral infection seen in India. It's spread from one person to another person by fecal-oral route of transmission. It means one infected person excretes the virus in stool and it reaches to the next person by contamination of drinking water. Epidemics are also possible after floods, in refugee camps, or in residential school. Unlike hepatitis A, we don't have any approved vaccine against hepatitis E in India. Hepatitis E is mostly seen in teenagers and young adults. It usually presents as mild jaundice, which usually resolves without any medication over 3 to 4 weeks. A small proportion can, however, lead to acute liver failure and death. It becomes especially problematic in patients with underlying chronic liver disease like Wilson's disease, autoimmune hepatitis, cirrhosis due to hepatitis B, C, or fatty liver disease. In that case, it leads to a severe form called acute on chronic liver failure, where there is very high chance of death without liver transplant. Hepatitis E infection in pregnancy can be very dangerous because it can lead to liver failure and death of the mother. To highlight the issue, I would like to call Dr. Tanushree Mahato, consultant obstetrician and gynecologist.
Hello everyone, myself Dr. Tanushree Mahato, consultant obstetrician and gynecologist from Purulia, West Bengal. On this occasion of World Hepatitis Day, I am here to talk about hepatitis E infection, particularly in pregnant women. In normal population, it is known to cause self-limiting disease, but particularly in case of pregnancy, its effect is very much detrimental, causing death in up to 20 to 25% of the infected population. It is usually transmitted by fecal-oral via contaminated water, food, etc. Following infection after about 7 to 8 weeks, features of viral hepatitis appear. Initially, there is prodromal symptoms, but later on, particularly in case of pregnant women who are in third trimester, fulminant viral hepatitis occurs, causing acute liver failure. Often there is death in about every 1 out of 5 patients. So the mortality rate is pretty much higher. No such specific treatment, no such specific vaccination is available in this particular infection. Treatment is mainly symptomatic and we should focus more on prevention. The exact cause of this severity is not known. Probably the complex hormonal changes or the altered immune regulation that occurs in pregnancy is the cause. Our primary approach should be mainly on focusing on decreasing the infection or preventing the infection from occurring. We should always avoid having contaminated water, avoid having street foods where contaminated water can be used. Proper human excrete disposal should be there. Also, while having water from open well, etc., the water should be boiled first to avoid having unpeeled or raw fruits, raw food, etc. And also another practice that is very common in India is having a toddler at home, and while handling the excreta of that toddler or while cleaning that child, sanitary hygienic practices should be there. Hand washing should be done properly so that infection doesn't happen or doesn't occur. Thank you. Hope this information helps.
Thank you, Dr. Tanushree, for your valuable input. To summarize, hepatitis E infection is another waterborne infection just like hepatitis A, except that we don't have any vaccine against hepatitis E and it's very problematic in pregnancy. So I would like to call pregnant ladies, it's time to control your cravings for street foods. Thank you.